I'm Dr. Mahadev Desai, Senior Physician from Ahmedabad. I've been practicing for last 25 years as a consultant physician. Today I'm going to talk about the importance of home blood pressure monitoring. Blood pressure which is recorded in the doctor's clinic and blood pressure recorded outside the clinic setting are slightly different. Many times patients come with a rush, or he might have taken a tea, coffee, alcohol, he might have been in the stress, and that itself can lead to erroneous blood pressure readings. And this is known as the white coat hypertension, where the patient's blood pressure recorded at the doctor's clinic is more than the one which is recorded outside the office or the clinic. It's very important that the blood pressure is recorded more than once. When the person comes to the doctor, the blood pressure is recorded hardly once or twice, maybe in 15 days interval or 1 month interval. But home blood pressure monitoring is one which is recorded by an instrument which works on the principles of oscillometry. So oscillometry is a very accurate, and secondly it doesn't have mercury, so the chances of mercury related problems are less. Another important part with home blood pressure monitoring is that now it is accepted as a diagnostic method for the labeling of hypertension by all the known organizations, be it WHO or American Heart Association or American Cardiology Society. So home blood pressure monitoring is going to be the order of the day for labeling somebody as hypertension. Home blood pressure monitoring person can record at odd hours also. Normal person has the blood pressure which is highest in the morning hours, but a blood pressure which is in the normal person lower in the night hours is called normal dipping. If a person has a blood pressure which doesn't fall at night, normally it falls from 10 to 15% of the daytime reading. If the blood pressure doesn't fall, that is called failure to dip. That itself is an indicator that the person is likely to develop hypertension in future. So one can record the home blood pressure monitoring, not only his but that of his family members also. We can adjust the dose of the blood pressure by going through the records of the HBPM, so that the persons who have got no nocturnal dipping or early morning rise, we can start an evening dose of drugs that itself can prevent many of the cardiovascular morbidity and mortality, including the strokes. So I for one believe that HBPM is very essential part of the management of hypertension. I support HBPM.